Welcome to Finding Contentment, the official podcast of the American Institute of Stress. The goal of this podcast is to explore the science, psychology, and practical wisdom that can help us manage our stress. If you are looking for personal growth and professional success, or just want a more fulfilling life, visit us at stress.org. And now here is the host and executive director of the American Institute of Stress, Will Heckman.
Hey, greetings, everyone. This is your host and executive director of the American Institute of Stress. It's Will Heckman. Thank you for joining us again for Finding Contentment, the official podcast, American Institute of Stress. Make sure you visit us at stress.org. While you're there, subscribe to our magazines. Take a look at all the information we have. You're going to be surprised of all the things we offer to members and non-members alike. And while you're watching us on YouTube, you know I'm going to ask you, please hit the like button, hit the subscribe button. It helps grow our channel. Today, we're going to be talking about men's mental health and how it's misunderstood, misdiagnosed, and basically ineffectively treated. And because of this, become a public health crisis. You know, the unique underlying psychological needs of men are often not addressed in many therapies. And joining us today is clinical psychologist, Dr. Josh Briley. Now, Josh Briley is a clinical psychologist with Parkland Health in Dallas, Texas. He's also CEO of Transformational Psychology Solutions. I'm going to put the web address underneath, but it's drjoshbriley.com. And Dr. Briley has over 20 years experience working with a variety of patient populations. He is a certified clinical trauma professional and a board-certified medical affairs specialist. His career, first as a psychologist for the Bureau of Prisons and then for the Veterans Health Administration, has given him extensive experience in the unique psychological needs and challenges facing men today. And as a result, he is a staunch advocate for men's mental health. And Dr. Briley is also an expert in the use of cranial electrotherapy stimulation, microcurrent in the treatment of anxiety, insomnia, and pain. And he has written and spoken extensively on this topic to providers and patients all around the world. And additionally, Dr. Briley is proficient in integrative behavioral health and has trained primary care providers on the benefits to patients and healthcare systems and integrating primary care behavioral health to more comprehensively and efficiently address the needs of patients and improve outcomes. And we're also very proud to have him as a fellow for the American Institute of Stress. So please join me in welcoming Dr. Josh Briley. Josh, thanks so much for joining us today. Appreciate it.
Thank you, Will. It's always a pleasure to speak with you and to speak for the American Institute of Stress.
You know, this is obviously it's an important topic. Both of us as men, it hits home a lot. But if you're listening to this and you're not a man, it's still important because there's men in your life, your fathers, brothers, sons, and this topic goes unaddressed a lot. And one of the first things I wanted to talk to you about is describe for us, if you can, some of the common misconceptions about men's mental health and how they impact men's even willingness to seek help.
So some of the common misconceptions is that depression and anxiety is going to look the same in men and in women. And it doesn't. A lot of the diagnostic criteria, or at least, and a lot of what providers look at when we're thinking of depression is more the emotional side, crying easily, feeling depressed, all of that. And men may feel that, but they're not as likely to express it. They're more likely to channel it toward anger or irritability, or they're more likely to bury themselves in some task in work or in a hobby, so that it doesn't necessarily look like they're isolating from everybody because they're busy, but they're still avoiding the problem by diverting themselves into something else. But a lot of times, over my career, I've had men sent to me with the referral question of they have an anger issue. And when I start talking to them, it's not an anger issue. It's that they're depressed or they're anxious, and that is how they feel comfortable channeling that emotional distress.
That makes sense. Yeah, I've seen that too, where guys act totally different than the women I know, and sometimes it manifests itself in real acute frustration and acting out and things like that. And but it does seem to me that men these days are facing a lot more stress. I don't know why. Maybe you can help me with that. Tell me some of the unique stressors that men face in today's society, and how those stressors, those unique stressors from men, how it affects their mental well-being.
Wow. So stress in general has gone up over the years. I've written for AIS about this topic based on the Gallup Pulse surveys and APA, both APA's surveys that show that we are just more stressed out than we ever have been before. AIS, executive and leader, Dr. Daniel Kirsch, has written about, how, in the 1700s, 1800s, even early 1900s, a doctoral level professional consumed 1.75 gigabytes of information over their entire career or their entire life. Yeah. And now we have more than that coming at us in a 24-hour period.
Right.
So we're just not physiologically equipped to handle everything coming at us all the time. Add to that, in most places, if you live in a metropolitan area like I do, traffic seems to be getting worse by the day. We're more socially isolated than ever before. Social media lets you connect to people around the world, but you don't know who your neighbors are. You don't, if you're having a problem, you can't reach out to somebody and say, hey, I need help, Whereas before, when life was slower, we knew the people around us. If you had a baby, then people brought food over. If you were sick, people rallied around you to mow your yard, help out with the house, things like that. Now we don't have that built-in support, most of us. A few still do. If you're a member of a organization like a church or some club, they will still do that, but it's, I think, become more the exception than the rule for most people. And so unique stressors for men, I would say, tend to do with just trying to navigate what that means now. There's a lot of things where traditional men's roles have changed, and that's both good and bad. We needed to change. We needed to evolve what it means to be a man. But a lot of what that means now is men don't know how to act. We don't know what to do. We don't know what's acceptable in certain situations. We don't know how to express ourselves because there is still the socialization of men can't have an emotional reaction. There's a couple of songs that I like that are out there that talk about, like, people tell men, wear your heart on your sleeve, show emotions. Oh, well, no, don't show that one. No, don't show that one. Don't cry, don't be angry. And then, a lot of times an employer or a family member, if a man does show emotion, it's seen as a weakness. And, whether it actually is or not, the man may feel that it is. And when you're dealing with stress and you're talking about a stress reaction and mental health, it is important how people respond to you, but it's also important how you see it. And a lot of times men still see crying or opening up and being emotionally vulnerable as a weakness. And so they're much less likely to seek help than women may be.
I get the feeling sometimes that men get mixed signals from depending on who they're with. And that's a problem. You want to react to something naturally. If you're on an island and by yourself, go ahead. If you're in a group of men, you're going to act differently. If you're in a group of women, you're going to act differently. And I think those mixed signals can have confused men as what they're
I mean, it can. I mean, I'm all for pro-social behaviors. I
right.
mean, all of my life, most of my friends and social group have been primarily women. And so I know that women act differently when they're together than when they're in a mixed group.
Sure.
Men don't necessarily have that skill as readily available. We think that what's funny to a group of men should be funny to a woman, and it's not always. So,
I know my
so
wife
I'm all
has
for
punched
pro-social
me off.
behavior, but there's also, like you said, that mixed signal of when is it appropriate, say, to open the door for somebody? When is it appropriate to even say hello to somebody without, them going, oh, you're being aggressive, or you're being inappropriate.
Right.
So, and it's not just the reaction that way from women. I'll get that a lot. I'll open the door for whoever's behind me because I was raised to be polite and a gentleman. And I'll get both men and women going, you don't have to open the door for me. I can do it myself. I'm like, I'm well aware of that.
Yeah, as I was raised the same way. I still do it. I always do, and I'm not doing it always. It's just I don't even think about it.
Right.
It's just who I am, and if I don't, it's not often someone says, "Hey, I can do it," but usually they're polite about it. I mean,
Right. Yeah, usually they are, but you still get that every now and then.
Get a funny look once in a while.
Yeah.
But the other thing I wanted to ask you, and maybe it's because of my personal situation of being God awful old, I wonder if the stress that men feel differs from different age groups. I realize some of it is normal. A young man trying to make a living, and somebody who's retired and not worried about that. Granted, those stress levels might be different.
Right.
But I mean, when it affects their mental health issues, a lot of when that unchecked stress leads to anxiety, leads to depression, does the age really matter?
In my experience, no. I've, had patients that are in their 20s, just starting out in life, and patients who were 70s, 80s. And the underlying causes for depression and anxiety in men seem to be the same no matter what. So.
Yeah, I hear that, and it's a lot of it has to do with how we manage those stresses coming at us. I know that. And the reason I asked that is because I was speaking with a young woman who is an MD, and she was discussing her stressors, and she's in her 30s, and they were much different at that age than they would be, say, for a woman in her 60s. And I think it had to do with, and the way she explained it to me was because of the childbearing years and things like that, and the imbalance between that and work and things like that. So it made me think, I wonder if men go through the same things. I know as I've gotten older, I don't know if there's less stress, but I think I've learned some management.
Yeah.
That helped.
Yeah, the individual stressors may be a little bit different, but the underlying needs that aren't being met that contribute to that stress
Right.
Are. One of the unique things about men is as long as we're getting our basic needs met, and I'm going to go into more detail on what those are in our upcoming webinar in December, just to kind of put a plug in for that. The underlying needs are to feel powerful in their lives. That doesn't mean, rawr, look at me,
Right.
Beat your chest, powerful. That means the actions and the decisions that I make have an influence in how my life goes. That's what I mean by a man needs power. They need to feel like they have some semblance of agency, of ability to impact positively or negatively the lives of, their own lives and the lives of those around them. And then they also need to belong. We often think of, if you look at most heterosexual married dynamics, the woman is the social butterfly. She's the one making all the friends, and the husband goes along, and his friends are the husbands of her friends.
Right.
Right. And that can be great if you get along with all of them, but men have a need to be along, to belong. They need to be part of something that they identify with. Ideally, it needs to be something positive that strives them to be a better person. And so some examples that I've seen of this are like men's groups at church, social men's groups, the Masons, the different lodges, Elks, Lions, all of those. Those are all very positive, hopefully, ideally positive influences.
Right.
Where men can plug in, they can be taught by people with more experience, older men or people with more education or more experience, and then they can pass that knowledge on to the people behind them. And that sense of belonging really helps men just feel, very mentally stable and sound. If both of those things are met, most men can handle whatever stressors come at them.
Funny, because that was the next thing I wanted to talk to you about, because you wrote about that in your recent article in Contentment Magazine, which you can find at stress.org, a blatant plug, about belonging to a group. We've talked in the past that I belong to a motorcycle club. It's a riding club, and that we do a lot of charity work. We do a lot of things together, but we also are there in support of each other. I have members who have gone through some real challenges.
Mm-hmm.
And who else are they going to turn to? A lot of times they don't want to burden their wives and children, so they'll talk to their social support system, which is the club or the clubs that you talked about, like the Masons. I have friends who are Masons and things like that. So I agree. There's a lot of good that can come out of that. And you made a really good point that, for instance, in my club, we have as much as a 30-year difference in age in some of the members. And some of them have young children. They're stressed. Mm-hmm. So, and sleep deprived. So, and they don't know necessarily what to do. And they could come to an older guy like me, and we could tell them our experience and maybe help them through it and things like that. There's a lot to be said for this. So you make really, really good points. Men should not isolate that themselves. I think they need that more than anything else.
Right.
The other thing I wanted to talk to you about, and I find this unique to men mostly, and that's about work. Men tend to, is in my experience, to define themselves by their work much more so than women do. When I say that, I mean that if you ask a man to define himself in the top 5 things, his job, his profession will be like 3, maybe 4. But, it's like, yeah, I'm a husband, I'm a father, I'm a psychologist, it's not even son, it's not. So do you think that tends to cause a unique kind of stress just for men because of that hierarchy of where they put their profession?
I believe so, because, and I would actually say men put their professions or their jobs even higher
sometimes
in their self-identity. I've said this for most of my career. If you ask a woman to walk into a room and introduce herself, and they start asking, trying to figure out who you are in relation, then stereotypically, okay, I'm not talking about all women in all situations, but like in a social setting, a woman's going to talk about who her partner is, who her children are, who her parents are. what church she goes to, it's more of a social introduction and self-identity. Whereas you walk up to 100 men and say, hi, I'm Josh Briley. Who are you? They're going to say, oh, I'm Bill Smith. I'm a police officer. I'm a firefighter. I'm a psychologist. I'm a doctor. I'm a plumber. I'm whatever. That's how they identify. And there's nothing wrong with that. With either one, not one isn't better than the other. It's just how we're wired differently. But at the same time, I feel like identifying with the social roles that you play kind of helps women have more of a buffer than men, because your job is, especially in this day and age, not the source of security that it used to be. I mean, if you're at a profession like, where you can transfer, from one job to another and still stay in that role, like with me, a psychologist, I've worked for several different agencies, worked for different companies. I've had my own practice a couple of times. I can still identify as I'm a psychologist. Doesn't matter where it is. But if you're, just to use a recent example, a dock worker, and your union goes on strike and you don't know how long that's going to be, or you lose your job because you get injured, then how do you identify yourself?
Right.
And I think it's also an issue for men upon transition of life. And I talk about this in a new article I have coming out for the winter issue of Contentment, that any change can lead to stress and grief, and even a positive transition like a retirement, just for or a disability. Then how do you introduce yourself? What do you say? I'm a former police officer. That sounds, that doesn't give you the same sense of identity of I'm a police officer.
You're dead on, because I am a former police officer.
I'm aware.
And I remember, I didn't do it. I didn't retire from it. I didn't do a whole career at it. I did it for a short amount of time. Excuse me, but I speaking to police officers that did transition and retire, it was for some of them devastating, especially back in the day when I was on the job.
Right.
They could not handle it.
Yeah, when I worked for the Bureau of Prisons, it was well known, the people who did their entire career in corrections.
Yeah.
They'd retire at 50, 57, whatever age, and they were usually dead within 3 to 5 years. Partly because of all the pent-up stress that they had not appropriately dealt with, which is why things like AIS and mental health and all that is so important. But also because they lost their sense of purpose. They had no reason to get up in the morning. They had no reason to do the things that they had done for 20 plus years. And so, if you're not growing, you're withering.
And you're absolutely right. And you're right. I mean, guys would put it, when I was a police officer, part of NYPD, it's changed now, but you did 20 years and you could retire.
Mm-hmm.
And some guys got on in their early 20s. Now they're not even 50, and they don't know what to do unless they stay on the job for longer than they probably should have, because it gets tiring chasing people. But then they don't know what to do. The ones that were successful found another purpose.
Yes.
They found another call.
I've had several patients, because I've done disability evaluations, for Social Security. And then even out in Parkland, I have people come in and they've been injured, or they have health conditions that prevent them from working the way they used to. And that's a tough situation on everybody. I don't want to downplay anything about what women go through with stress or mental health. It's just the focus today is on men. But men especially, like I've had several of them come in and say, if I'm not working, if I'm not this, what am I?
Yeah.
I don't even know who I am anymore.
Right. They lose who they are. That's a really good point. And I have to tell you that I was friends with police officers who were men and women, and I have heard of instances where men, you're right, they 5 or 10 years, they're dead. Sometimes it was by their own hand
Sadly,
because they
yeah.
could not handle that transition. I never heard that about a woman.
Right.
Women were much more capable of finding purpose after and keep going and still find meaning in something else.
Right.
And I
Well, and
think part of
that's
it has to do with just men were afraid to ask.
hmm Well, and that's part of why I label men's mental health as a public health crisis.
Yeah.
84% of suicides are men.
Yeah.
Men are 40% more likely to be, I think I'm getting the numbers right, but they're more likely to be misdiagnosed by providers, even by mental health providers. They're much less likely to seek help. For one thing, there's the joke, men don't like to go to the doctor anyway, right? We don't, you know, but especially if you're asking a man to go see a therapist, there's going to be big pushback because therapy, no matter what level the therapist is, whether psychologist, LPC, social worker, LMHC, we're all doing the same job. We're all, very dedicated and hardworking. But therapy is set up, if you think about it, for the way women cope with problems.
Mm-hmm.
A woman will, and it's been a source of disagreement between heterosexual married couples since the beginning. The woman comes home or the man comes home, the woman starts talking about her problem, the man offers a solution and gets in trouble because the wife doesn't want a solution, she wants to talk about it, right? All of us, right? So men have to learn to just sit and listen.
Right.
But the reason a man does that is because two men don't approach each other and say, hey, I'm having this problem, let me tell you how I feel about it. A man will go to somebody else for help because they think that person knows how to fix it.
Fix it. Yep.
You know,
We need to fix things.
yes.
And when we
so,
can't, we feel terrible.
Yeah. And so therapy with men is a little bit different animal because it is important to get them to talk about how they feel. It is important to get them to engage in the coping skills needed to cope with emotional distress. But first, you have to get them to admit that there's emotions. When I was at the VA, I was working with veterans with PTSD and depression and all this, and I'd start talking about emotions, and they'd be like, "What are you talking about? I don't have emotions." I'm like, "Dude, you were crying coming in the door.
Right.
That's at a." And oh no! I had something in my eye. Oh, okay, So, and just the idea, even for a man who's not struggling with anxiety or depression, to sit down and talk about how we feel makes our skin crawl. I'm a psychologist, and sitting down with my wife to talk about how we're feeling and how the marriage is going, I've got to like make myself do it, and I'm supposed to be the one who's like, hey, talk about your emotions. This is great.
No.
But so what I have found helpful is, again, to explain to men that they have those basic needs. They need to feel powerful. They need to belong. And let's find out how we can get you plugged in, how we can get you doing some things that will make you feel like you have some control over your life. Focus on what you are able to control. And then it's easier for them to be like, oh, okay, so this is, my anxiety's been controlling me. That's why I feel so powerless. But you're telling me if I do this breathing exercise and I start physically exercising, then my anxiety goes down, I feel more in control. Okay, now I get it. It's a very different approach than
right.
trying to address the same problem. Because the woman will come in and tell you, I'm feeling anxious, I'm feeling depressed, I'm crying all day, blah, blah, blah. And man's going to come in and say, I don't know what's going on.
I've experienced that myself. Guys have come to me with sometimes serious problems.
Mm-hmm.
Because I'm the leader of the motorcycle club. They feel, and I'm really happy that they do, comfortable, and because they know it's in confidence, and they'll come practically in tears, and they say, I don't know, I don't understand, I feel like crying. My answer to that is, what kind of man would you be if you didn't feel that way? And
I like that.
you wouldn't be a kind of a man who could be my friend if you didn't feel something about what you're going through. And I think sometimes that sheds a light on it, that it's, first of all, it's okay. And now let's talk about, like you said, some of the things you could do, some breathing exercise, more, do change your diet, eat a salad, dude.
Yeah.
Which has come out of my mouth. and the men are looking for, what should I do?
Mm-hmm.
Not just talk. You're right. Not just talking about it. You know, I was looking, and in your upcoming webinar, which you mentioned before, by the way, it's December 4th for those of you who are watching this, and you can go on stress.org and register it for it. There's a place you can do it. You talk about something I wanted to ask you about, because I really am unclear about it, and that's avoidant men. Can you clear that up and talk about that a little bit?
So what I'm talking about there, and I don't want to give away too much that's going to be talked about in the webinar, because, you know, everybody come see me again in December for a more detailed discussion. But if men's basic needs aren't being met, there's different ways that they're going to try to get those needs taken care of. So just for a quick example, you know, somebody who doesn't feel like they have any control over their life, they may become very aggressive and potentially even abusive to those around them that they feel have less power than them, or quote unquote safe. But somebody who has tried several things to, you know, they've tried to do things to feel that sense of power. They've tried to do things to feel like they belong, and the door just gets slammed on them, you know, over and over and over again. Then they're going to learn that they're pretty much very powerless and helpless and not worth anyone's time. And so they're going to start avoiding kind of everything, everyone. They will socially withdraw. They will become, you know, that quiet, weird dude that nobody talks to. And so it becomes kind of this self-fulfilling prophecy of, nobody wants to talk to me, nobody wants to engage me, so I'm stuck in my own head. And then the more I avoid people, the more of this kind of weird vibe I give off. And it leads to a lot of mental health issues.
Yeah, okay. I understand what you're saying. You know, and I see that a lot. If I can't fix this, I'm just going to avoid it.
Right. Or they may
And
avoid
it doesn't go away.
Yeah, or they may avoid it by alcohol abuse, drug abuse,
Yeah.
gambling, pornography. A lot of addictions, especially in men, have that sense of powerlessness and trying to fill a void component to it. So when I'm doing addiction counseling, I'm always like, we've got to find something healthy to replace that with.
You know, that kind of leads into the next thing I want to talk to you about. Okay, so I think, for whatever it's worth, one of the biggest problems is that, and I looked this up, it's only 40% of men with a reported mental health issue, with a mental illness, seek any kind of help.
Correct.
That's the ones that are reporting it. And only
Correct.
16% of men who have have even seen a therapist. Now, okay, so I realized that at one time there was a lot of stigma surrounding mental health. I thought we were getting past that.
As a society, we are. But it also goes back to exactly what we were talking about a while ago. And I've even seen jokes online about it, but it is true. Male mental health providers are a minority. I don't have the exact numbers at hand. I think I talked about them in the webinar because I looked them up for that. But you know, most mental health providers, especially therapists, are women. And again, that's because it's a very touchy-feely field. You know, you're dealing in the realm of emotions,
Right.
and that's just not, you know, most men are going to go more toward engineering, If they go into the helping professions, in medicine, they become MDs, DOs,
Even nurses. Yeah.
even nurses.
Yeah.
And so even though nurses, it's still wildly skewed toward women, to the point where we even say male nurse instead of
Right.
nurse,
That's a good point.
So, and so then, and some men, especially if they are even willing to admit to themselves, okay, I'm having a problem and I need to seek help, or they're willing to capitulate to their family going, this can't go on, you've got to get help. A lot of them aren't comfortable talking to a woman.
Well, what do we do? I mean, you obviously are you very uniquely qualified because I mean you worked in prisons, you worked for the VA, you dealt with a lot of men or mental health issues. What advice do you give to men who say I just can't bring myself to? I know what I say to them, but what would you say to the people, to guys who are hesitant about seeking mental health or any issues or stress related issues just because they are hesitant to do so?
I always tell them to, go for it. It's like you said, what kind of man do you want to be? If you had a broken leg, you'd go get it set, and you would take the time that you need. You would do what you had to do. If you had a heart attack, and admittedly, there's a lot of men who are like, I'm fine, even with a confirmed serious medical issue. But once you've had a heart attack and you've had that open heart surgery and all that fun stuff, most people are like, okay, I need to make changes in my life. It's the same thing with depression and anxiety. In fact, there is no health without mental health. There is no, when I was in school, we talked about the brain body distinction. There is no distinction. It's all connected. It's, and this is what I tell when I'm talking to primary care providers about integrative primary care or integrative behavioral health. There is absolutely nothing that a physician treats that does not have an emotional component to it. And depression, anxiety, panic attacks, all of the stuff that I treat as a mental health provider have physical symptoms to them.
Yep.
So,
and probably why
me out.
The statistic that I've seen that 75% of doctor visits are caused by stress, or couldn't find their origins in some stress-related issue.
Well, yeah, stress is a causal, or at least a contributing factor to pretty much every medical problem that we have.
Yeah.
Cancer, stroke, heart problems, hypertension, Alzheimer's. They're now showing that dementia, one of the ways to prevent dementia is taking care of your mental health early on, as well as your physical health.
It's really a good point. I mean, we could talk about men's mental health and for a very long time, because I have a lot of questions, but like you said, I think you're going to cover more on the webinar, and we can't talk all day, although I could.
I could too. Sadly, I have a hard stop. So
yeah, I know, and I want to respect that. But I do have one question. You know what I'm going to ask too, because I love the answer. I'm just saying. But I ask every guest on the show, so I'm going to ask you too. It's been a stressful day. What does Dr. Josh Briley do to help him manage his stress?
It depends on the circumstances. I will, if I have time, and depending on my fitness level, I'll work out. I will listen to music. And this is something I tell patients is you got to find what works for you. So for a lot of people, when you're thinking, oh, I'm going to listen to music to calm down, it's soft,
How
The
could you
train.
not feel better after listening to Enter the Sandman?
Exactly.
You know,
Right?
I'm right there with you, Josh. That's a great answer, and it proves to people, all the people listening, that what he just said is so important. It's what works for you,
Right.
and it could be a lot of different things. I don't care if it's meditation or boxing. I don't care. It's what works for you. The one thing they should never do is nothing.
Exactly.
Josh, thanks so much for joining us today. I appreciate it. I look so forward to that webinar. You've given, we're lucky enough to have you give one in the past. It was one of our most watched webinars we've ever had in the history of the AIS, and I expected no less for the next one.
Here's hoping.
So I want to thank you. Also, if you're still listening to this, don't forget to check out his articles in Contentment Magazine. Go to stress.org, subscribe to the magazines, and they'll just send you a notice when the next one comes out.
Right. And while you're there, sign up to be a member. It's $95 a year. It's nothing.
And we give discounts to military and students.
Exactly.
Come on, you'll find it's the cheapest thing you'll ever spend on your health that will have the most benefit.
Exactly.
Other than eat a salad. Hey, this has been your host, Will Heckman. I want to thank you once again for joining us today. Don't forget, follow the podcast, hit subscribe, hit the like button. I want to remind you as we leave, just as stress is different for each of us, there's no one stress reduction or management strategy that's right for everyone. So that means you need to join us next time as we explore more stress management strategies and tools and insights.
Exactly.
We'll see you next time.
All right. Thank
Have
you.
a good one.
Thanks so much.